Anytime there's a new piece of technology out there, I can't wait to get my hands on it. How about this? Piece of technology that'll get rid of those stubborn pounds around your midsection without going under the knife at all. And not only is CoolSculpting non-invasive, it can also be done during your lunch break. But does it really work? Here to show us is dermatologist Dr. Ariel Ostad, and he's one of the leading doctors in New York using this new technology. Doc, nice to see you this morning.
Nice to see you, Clayton.
All right, what is CoolSculpting, and why is this taking off in countries like Brazil, where you have these clinics, people showing up on their lunch break? Explain this for us.
So CoolSculpting is a clinically proven non-surgical procedure that gets rid of stubborn fat. In the past, we've relied on liposuction, which requires surgery, downtime.
Cutting and all of that.
Exactly, and pain. Well, now we have this exciting new technology that is cleared by the FDA that's been shown to reduce stubborn fat.
We have some before and after pictures here, which are actually pretty amazing, and it freezes off the fat, right? This is how it works. You put on the contraption, and it actually goes underneath the skin and freezes off the fat, and your body gets rid of it?
That's exactly what it is. Basically, it's delivering cool energy through a laser-like device where over an hour we're able to freeze the fat beneath your skin. Patients afterwards basically go back to their work, and over a course of 2 to 3 months you see approximately a 20 to 24% reduction in the areas that was treated.
So that's like 1 to 2 inches?
Patients have certainly come back and told me they've lost about 1 to 2 inches. Their clothing has fit better, and they're very happy.
All right, my pants are a little tight, Doc. Can you show me how this thing works?
So just to simulate the technology to you, so basically this is the device, this is the applicator.
Ladies, should I pull up my shirt? I just heard some men in here, so I'm not going to do that. All right, so you put it on the...
So basically, this is the applicator. The applicator gets attached to your skin, and there is a suction cup that grabs your skin very gently and pulls your skin inward. And then over a course of an hour, there is this cool energy that is able to freeze the fat without damaging the skin overlying it. After an hour, basically the applicator is removed, patients put on their clothes, and they go back to work.
What I found fascinating about some of the research is that researchers back in the day, 50 years ago, discovered that kids who were sucking on popsicles repeatedly, every day, they started to notice that they were losing weight in their cheekbones. Is that right? Because they were sucking on cold temperatures?
That is absolutely right. There was basically a published article about 40 years ago that was able to show that there's this condition called popsicle paniculitis, where kids, through sucking on the popsicle, lose their fat. And basically 40 years later, the same technology was basically created to simulate what was happening there.
You know, I have to admit, there were some men floating around our studio this morning that said, that's really fascinating. They admitted to me. So why is this really popular with men? That I'm reading more men doing this than seems like ladies are doing.
Well, certainly, I think, given our culture, men are beginning to realize that it's important to look good, whether to remain competitive in the workplace. And what's great about this technology is that this is something men can do during their busy schedule. So they can come in during their lunch hour, get the treatment, and go back to work, and they don't have to really take that time off.
That's great. Dr. Ariel Ostad, see, a lot of skeptics in here. You saw the before and after pictures. Nice to see you this morning. Thanks for showing this to us.